Hey, Dr. Elizabeth Eldridge here with BodyWorks Women's Health and Wellness. I am a doctor of physical therapy with a specialization in pelvic and women's health. You might be a little curious to know a little more about the pelvic exam and maybe a little bit surprised to find out that PTs do this, but it's all about understanding the inner workings of the deep core. There are muscles there. And the pelvic exam can yield some pretty helpful information for us to determine what treatment and plan will be most helpful for you to reach your goals. So I'm here to dispel any fears or jitters about the pelvic exam. First of all, the exam should always be explained to you first. And secondly, the exam should always be done with your enthusiastic consent. So let me go ahead and kind of talk about it a little bit. First, you'll be asked to remove clothing from the waist down. You'll be laying down on a table, kind of like this. It has sheets on it and sheets over top of your waist going all the way down to your feet. It is real sheets and not crunchy paper, which is nice. The PT will have gloves on her hands to do the exam, and there's first an outside portion and then an inside portion. So let me explain just a little bit about the anatomy and then I'll explain the exam. So this is a female pelvis. Here are some of the spinal segments of the low back. Right along here is where the abdominal muscles start. If we look down into this circle, this is where the bladder, if you have a uterus, it's there, the rectum is there. Down there, that little triangle bone is the tailbone right there. And then we come off to the side, this little socket right here is where the hip sits. I always like to first kind of admire the interconnectedness of all of that. It's important to understand that, and that's why it's helpful for us to look at this group of muscles when we're dealing with any sort of issue in this region. Okay, so this gal is laying down on her back right here, and these are the sit bones that you maybe feel if you're sitting on kind of like a hard bleacher. So the sit bones right here is where the PT will anchor her thumbs first and have you try a Kegel, like a pelvic floor contraction. You may or may not know how to do that. That's totally okay. We just need to see what your baseline is so we can figure out how to best help you. Then you'll gently bear down. You may be asked to do a small cough. We're first trying to understand what the mobility and range of motion and reactivity in the pelvic floor is like first. Then with your consent, the PT may palpate, which just means touch and assess some of the muscles that are on the outside, because there's these superficial muscles here that can sometimes have some issues that we need to help with. Then again, with your consent, you'll be asked again if it's okay for the PT to insert a single finger into the vagina. So the vagina then can go to the second layer of muscles, and the PT can be able to assess those muscles where you'll be asked to do some more pelvic floor contractions or Kegels. You may be asked to hold one, you may be asked to do a couple in a row. That way the PT can understand what your strength, your coordination, your endurance is like, and whether your pelvic floor is kind of tense at rest or whether it's actually a little too lax at rest. So all of this information gives us some really good pieces to understand exactly how we can best help you. Sometimes people wonder, what if they're on their period? Do they have to skip the pelvic exam? And the answer is that's really up to you. We do not mind. We work with women all day. Inevitably, someone's on their period. But if you feel really uncomfortable or it's kind of an uncomfortable, heavy day for you and you want to skip the pelvic exam, no problem. We can either just do the external portion or we can defer it to another visit. Another question we get, or a concern we get, is, oh goodness, I haven't shaved or waxed or groomed down there. And just want to let you guys know that As PTs, we see all different kinds of grooming preferences and patterns, so that is no concern to us. We are really just seeing this as a muscular assessment to figure out what's going on with your core. So all types are welcome, and our care is patient-centered. So if you are not feeling comfortable either physically or mentally and emotionally with the idea of a pelvic exam, perhaps you have experienced some past trauma or abuse that makes you more hesitant, that is no problem. Please make sure that you're letting us be aware of that, and we are more than happy to accommodate you or wait until you feel more comfortable. We look forward to seeing you soon.